Welcome to Medical Ward BSN 3E Group 3, Second Rotation, NCM 116 Early, Nursing Care Management 116 Early, Medical Surgical Nursing 2, Virtual Clinical Duty. This is our second week, and of course, our case scenario for this week is focused on patient EF diagnosed with spinal cord injury. But before that, please allow me to share this premise. I am here for you. It's literally my life's work to help you grow and also be guided with our learning outcomes for this week. On completion of this case study, student nurses will be able to first build knowledge related to the patient's medical experience. Second, continue to develop a comprehensive assessment and monitoring skills. Third, recommend nursing interventions based on a case presented. Fourth, define the roles and the contributions of student nurses in the care of medical patients. Fifth, justify optimal therapy based on the current understanding of the case. So this will be the base of the evaluation at the end of this case analysis. Please be reminded also with the following instructions. All critical thinking questions presented within or after the case applies to this case study. You have to create a brief and to the point responses, and of course there has to be no flowery words. When asked to provide several answers, it must be listed in order of priority or level of significance. Base all your answers on the data that is presented and do not assume information that is not provided in the case. Further, please follow the format of your output, especially on its font style, font size, paper margin, and paper size. Save it as PDF file and submit all your requirements per group on date specified as its deadline. Send all your requirements via the official email address of your clinical instructor, and it is advised that you will submit all your requirements on or before the set deadline of submission. Furthermore, kindly follow this format in saving your requirements for easier monitoring. For daily requirements, you know that one on the first week, and also with your weekly requirements, you know that one during our week 1. Let's now have your case scenario of patient EF with spinal cord injury. Patient EF is a 22-year-old man, single Roman Catholic by faith, and is currently residing at Barangay Bulwa, Cagayan de Oro City. He fell from the rooftop while changing their GI sheets at home. He is now at the emergency department of Maria Reina Xavier University Hospital with a suspected T5 to T6 fracture with paraplegia. Physician's orders includes insert Foley catheter, ECG monitoring, immobilize cervical spine, oxygen at 4 liters per nasal cannula, initiate 2 large bore IVs, neurologic assessment every hour, and apply warming blankets as needed. The diagnosis of the fracture is confirmed and patient EF is transferred from the ED to the CICU. Although EF's injury is at a level where independent respiratory function is expected, he experiences low oxygen saturation levels and is placed on a mechanical ventilator. The physician states that this is due to spinal shock. Patient EF was taken to surgery 48 hours after the accident for spinal stabilization. He spent 2 additional days in the CICU and 5 days in the neurology unit and now is ready to be transferred to a rehabilitation medical ward. He continues to have no movement of his lower extremities. EF turns on his call light and asks for medication for headache. As you walk into the room, you immediately note that EF's face is flushed. You suspect that EF might be experiencing autonomic dysreflexia. You immediately refer the situation to the attending physician and appropriate interventions were instituted to patient EF's condition. After a few days of hospitalization in your unit, the physician evaluated patient EF and considers him a candidate for discharge. Nursing care is continued up until patient EF settles his hospital bill. Let's now have your high 5 critical thinking questions. Number 1. How would you explain spinal shock to EF's family and why EF requires mechanical ventilation at this time? Again, how would you explain spinal shock to EF's family and why EF requires mechanical ventilation at this time? Number 2, list 3 critical potential infections that EF will be monitored for throughout his hospitalization. List 3 critical potential infections that EF will be monitored for throughout his hospitalization. Number 3, EF is taking vitamin C 2 grams orally 4 times daily. What is the purpose of this and what other nursing actions should accompany vitamin C therapy? Again, EF is taking vitamin C 2 grams orally 4 times daily. What is the purpose of this and what other nursing actions should accompany vitamin C therapy? Number 4, EF should also be taught bowel techniques. What should this teaching include? Again, EF should also be taught bowel training techniques. What should this teaching include? Number 5, EF asks you whether he'll ever be able to have sex again. What do you tell him and what are some possible referrals? Number 5, EF asks you whether he'll be able to have sex again. What do you tell him and what are some possible referrals? Let's now have your daily requirements. For day 0, Sunday, case scenario loading. For day 1, Monday, the requirement includes your GOSODPA Survey 1, Nurses Notes 1. For initial knowledge about the case, that includes physical assessment, pathophysiology, diagnostic tests, drug study. For day 2, Tuesday, you have to have your SODPA Survey 2, Nurses Notes FDAR 2, weekly evaluation, reflective journal reading, critical thinking answers, initial knowledge about the case, and that includes a problem list, nursing care plan, discharge plan. Weekly requirements includes your introduction, nursing health history, physical assessment, anatomy and physiology, pathophysiology diagnostic test, drug study problem list, nursing care plan, discharge plan, learning outcome, of course, your references. That has to be on an APA style. Deadline of submission for day 1, March 8, 2021, Monday, 11:59 p.m. For day 2, March 9, 2021, Tuesday, 11:59 p.m. For week 2, March 13, 2021, Saturday, 11:59 p.m. We are all on our own journey, but in this class, we all need one another and will help one another grow. These are my contact details. This has been Joseph Bahian Abang at your service to make your best even better. To God be all the glory.